have cancer, you want a second opinion, or you recently diagnosed with cancer, you need to search for a great cancer doctor, look no further than OHC, the cancer specialist, 888-649-4800, online, ohcare.com. Welcome back. It's been about a year to the 55KRC Morning Show. In studio, Dr. Akash Mukherjee, who is a blood cancer specialist. It is Blood Cancer Awareness Month. We've got one of those. Doctor, good to have you back in.
Thank you so much, Brian, for having me over.
And, of course, near and dear to my heart, lymphoma, one of the blood cancers you're a specialist in. By way of background, Dr. Mukherjee is a hematologist, medical oncologist, bone marrow transplant specialist, and cellular therapy expert. Areas of interest, CAR T cell therapy. We've talked about that before. Leukemia, lymphoma, aplastic anemia, clinical research. They've always got clinical trials going on in OHC. Let's start with what's the difference between lymphoma, which is what I've got, and leukemia, both blood cancers?
That's a great question, Brian. I mean, lymphoma, we can start off by talking about that. I mean, it's the 8th most common cancer in United States, and every year, roughly, there are 80,000 to 90,000 new cases. And lymphoma is essentially a cancer of your lymphatic system, the immune system. And you have lymphocytes, which are a type of white blood cell, and their function is to get rid of any type of foreign pathogens, bacteria, virus, fungus. But because of certain genomic mutation, abnormal chromosomal translocation, those lymphocytes, they start to divide in an abnormal, uncontrolled, excessive fashion, and they start to cause lymph node swelling, painless lymph node swelling. It can involve your liver, spleen, can cause enlargement of the liver, spleen, and then it can even infiltrate the bone marrow, causing low counts. So the most common type of lymphoma which we see here in U.S. is your non-Hodgkin lymphoma, and that's about 80-90% of the total lymphoma cases. And then you have Hodgkin lymphoma, which is about 10% of those. And in non-Hodgkin lymphoma, you have the diffuse large B-cell lymphoma, follicular lymphoma. Then you have leukemia, on the other hand, which is an entirely distinct entity, and that's cancer of your involving the blood and the bone marrow. And you have white blood cells. It could be mature, or it could be the precursor of white blood cells, such as the blast cells or the stem cells, and they start to divide out, out of control. And they encroach your entire bone marrow, leaving no room for healthier cells to grow. So
that's metastasizing, right?
Correct, yeah. And essentially what happened is, since your normal hematopoietic stem cells or blood stem cells, since they are not dividing and maturing the way they should be, and your marrow is getting infiltrated with all these bad cells, the leukemic cells, your count start to drop low. So if your white count, if it gets too high or too low, now keep in mind those are just dysfunctional white blood cells, then your patient is more susceptible to recurrent infections or fever. If your red blood cell count or the hemoglobin drops too low, you are just out of breath and exhausted, feeling fatigue all the time. And then the other cells which get affected is the platelet. And if they drop too low, then you are at increased risk of bleeding. So a lot of time your leukemia patient will present like that. Now, in U.S., in the adult population, we primarily see AML, acute myeloid leukemia, which is an aggressive blood cancer. In pediatric population, we primarily see ALL, and then and that's more of an immature white blood cell cancer. And on the mature white blood cell group, CLL, the chronic lymphocytic leukemia, is the one which is more common. But over the last, I will say, 2 decades, the treatment landscape has evolved dramatically, and your cure rate and survival rates have pretty much doubled.
Oh, that's wonderful.
With, back in the old days, we used to rely on chemotherapy, and chemotherapy still has a pretty important role. But with the advent of immunotherapy, you have the BiTE therapy, the bispecific T-cell engager, the targeted therapy, and the CAR T and cellular therapy. And in certain group of patients, the use of stem cell transplant or bone marrow transplant, and better supportive care, your survivorship has gone up, and the field is only looking more and more promising with all these new drugs coming up.
I love that. Now, is like, for example, CAR T, I always like to think of them as sort of bespoke treatments. You're tailoring them to the specific patient. It's not an off-the-shelf fill a prescription kind of thing yet. Am I still accurate on my general understanding of that?
Oh, yeah, right. So essentially, with CAR T, you are trying to harness the patient's own immune cell. And a lot of time, disease like leukemia, lymphoma happen because a patient is immune compromised, or for whatever reason, their immune cells, primarily the T cells, they are not able to identify and recognize the cancer cell, and they cannot kill those cells, so they are able to grow unchecked. But if you can harness the patient lymphocyte or the immune cell, genetically engineer them, target them with a receptor which identifies the protein
Mm-hmm.
expressed on the cancer cell, you can infuse those cells back and kill the leukemia
You're
or
basically
lymphoma.
training them to
And
go after the cancer.
correct, yeah, you are basically arming them with a better gun so that they can kill the leukemia, lymphoma, and put patient back into remission.
Fair enough. Dr. Mukherjee, I stumbled upon my cancer inadvertently.
Mm-hmm.
It was some other completely unrelated medical condition I had, which resulted in me getting a CT scan, which confirmed that no, there was nothing wrong with me. However, the CT scan revealed that my lymph nodes had grown, and that's when I started seeing you or the cancer doctors at OHC. So that's my little path there. I didn't know that, for example, I was experiencing night sweats at the time. I never connected that with anything medically. Never even thought about it. It's just, this is weird. I started getting night sweats. But what are the symptoms people should be looking for when it comes to blood cancers? Are there parallel symptoms with lymphoma and leukemia?
Mm-hmm.
So what are they? What should we be looking for?
Excellent question, Brian. I think what people don't recognize is with leukemia, lymphoma, I mean, it's very common to have painless swelling of the lymph node.
Yeah.
And along with it, you can also have B symptoms. And what that entail is you can start to have recurrent fever. You can start to have drenching night sweats. And, a lot of time patients, they dismiss them. Oh, the weather might be too hot, or
Right.
I just have way too many covers, or my hormones are off. Or sometimes you start to have unintentional weight loss. That means without
Yeah.
modifying your diet or without working out, you just start losing weight.
Yeah, I
And,
never got lucky that way. I always joke about that. How come I never got the weight loss as a symptom? I got cancer, damn it. I would like to have the weight loss with it.
A lot of patients
I'm sure.
tell about the same thing, but hey, you don't want to lose weight by having cancer.
No, I know.
But so those are some of the common symptoms. Besides that, patients can have progressive fatigue. They feel like they're just drained out at the end of the day. They can have unusual bone pain, shortness of breath with exertion. They can have abnormal excessive bleeding, like when they're brushing their teeth. They can be bleeding from their gums.
Oh, how about that?
Itchy skin. So yeah, I mean, if at any point you are concerned that something just doesn't feel right, they should approach their primary care and just request for a general blood count, a complete blood count.
Yeah.
And a lot of time that's able to capture bulk of your blood cancers. And just a simple lymph node examination, which only takes like 2 minutes to do, and checking for enlarged spleen and liver can assure the physician that you are either okay or be into some kind of trouble.
I suppose this suggests that's a good reason for everyone to at least have an annual physical, because they'll do blood work.
Oh yeah, absolutely.
Okay.
Yeah.
Wonderful advice on that one. Now, risk factors. Let me guess, smoking is on the list. It's always on the list for every cancer, right?
Yeah.
What else?
Smoking, alcohol, you can always put them at the risk for pretty much bulk of the cancer. Just being overweight, when you are obese, that has been shown to be associated with excessive sugar calorie intake that can mess with your gut microbiome. When you eat low fiber diet, lot of processed food, it can alter your gut microbiome. And these days we are having ton of data that how gut dysbiosis, that means you have essentially gotten rid of the good bacteria in the gut, and it's just overpopulated with bad bacteria, and that can somehow affect your immune functionality, which in turn increase your risk of developing lymphoma or leukemia. Or if someone has autoimmune disease or they are on immune suppressive medication, and sometimes there are certain leukemia, lymphoma which we see more commonly in older age. Now, obviously, that's something which no one can avoid, but just in general, having a more plant rich or plant based diet with a lot of fiber, making sure including a lot of pro, like your healthy gut microbiome based
Yes.
diet, and staying hydrated, working out for at least 30 to 60 minutes every day. Just those are some of the things which we can do on our end.
And get the sugar out of your
And
diet.
oh yeah, absolutely. You wanna get rid of the sugar or have avoid simple carbs or processed carbs out of your diet.
Doctor, I know you guys always have clinical trials going on. It's one of the things OHC is known for. How about clinical trials with regard to the blood cancers we're talking about this morning?
Oh yeah. At OSC we have more than 10 different clinical trials just for these two type of cancers, leukemia, lymphoma, and then we have whole bunch of clinical trials for other blood cancer like multiple myeloma, MDS, and where we essentially try new medication along with the standard of care treatment. And there are some clinical trials which are first in human trial. OSC was the first place in Greater Cincinnati area to offer CAR T, the chimeric antigen receptor T cell therapy for relapsed refractory lymphoma. So we are always at the forefront with clinical trial as well as cellular therapy or immunotherapy. And our clinical trials are crucial to our fighting these blood cancers and providing our patient with better outcomes and longer remission.
Dr. Akash Mukherjee, one of the outstanding doctors at OHC. To reach OHC, either initially because you've just found out about it or to get a second opinion, the number is 888-649-4800, 888-649-4800. Again, online at ohcare.com. Very positive information, as always, from the folks at OHC. Doctor, it's been a pleasure talking with you. I'm excited about the developments in specifically the lymphoma area. Selfish me, but at least I know I'm in fantastic hands with the care I'm getting at OHC, and I know my listeners will be as well. Keep up the great work, Doctor.